Innovative Marshfield, the Coven Connection and Marshfield broadcasting is sponsored by the Vault Marshfield. This downtown hub brings entrepreneurs, creatives, and small businesses together under one roof. Enjoy co-working with the Coven, Uptown Coffee, and boutique shops at the 715. The Vault is where ideas grow and community thrives. Learn more at vault-219.com and thecoven.com/Marshfield. Thank you for supporting local community TV.
Welcome to Innovate Marshfield, the Coven Connection. This is a show where we highlight individuals in the community that have turned entrepreneurs, have been entrepreneurs, building something new, unique, or just something interesting in our community that we'd like to highlight. So today I am extremely excited to share that we have the new pediatrician in town, Dr. Amy Falk with Revision Wellness, and we're going to talk a little bit about her new practice and what that means for the community of Marshfield. Amy, it's great to have you.
Thank you so much for having me today.
So, and of course, I've known you your whole life.
Yes,
which
I
is
know.
amazing.
It's so fun.
So this is actually probably more fun for us because we know each other. So
right.
that's really exciting.
Yeah.
But I really want to maximize the time that we have today to talk about Revision Wellness because this was a really great step for you and a really exciting step and very different than probably you thought you were going to be doing, 10 years ago. If somebody had said to you, I'm going to be owning my own practice, you probably would have said,
no way.
Not for me,
Not
right?
For me. I can't do it. Yeah.
But here you are.
Yeah.
And so let's start kind of from the beginning. So you've been practicing for 9 years. Can you just talk a little bit about your background, your education, that kind of thing?
Yeah. So I grew up in central Wisconsin as well with my husband, who's a private practice optometrist. And I went to medical school in Chicago and did my residency at UW-Madison. And I'm a pediatrician. So that means just through kind of early adulthood. Got some really great training and we wanted to come back and practice in our hometown. And so I joined the large medical group in my hometown and practiced there for 9 years. And it was amazing. And I learned a lot, saw a lot of children. And then I think a lot of people have noticed and felt that healthcare in the past several years, for sure the past year or two, have really begun to shift. And it just became untenable for many reasons for me. And I just really felt like I could do something better for my patients, give them the time that they need, the service they desire. I just knew I could at least try to do it better. And so sort of threw my hands up in the spring of this year. And as of October 1st, opened Revision Wellness, which is a direct care pediatric practice.
Yeah. So can you talk about what a direct care pediatric practice is? I don't know if everyone understands that term, and it's relatively new for smaller communities.
Yeah.
So I would love to learn a little bit more about that.
Sure. So direct care is just that, where it's direct between a physician or a provider and the patient and their family. So I like to think of it as the oldest type of medicine. And it's very similar to how we do everything else in our economy. Like if I go get my hair cut, I don't have an insurance company dictating all the things. I just go and get what I want to have done and pay that person. And so it's a way, it's a growing movement nationally, sort of started with family medicine. And now there are even specialists that are doing it this way, where they're just taking a step back from insurance and the big health kind of bundles and saying, I think a simpler way is better. I think I can get better care that way, and offering care directly to the patients. And while this seems, I feel like many times people are, frightened at first. Like, what do you mean I can't use my insurance? And they're, just really kind of unable to think outside that box. I really encourage people, especially in the past several years, and for sure looking onward, healthcare costs have never been higher. And they're projected to increase even more. And so you pay for a, quote, membership to hold your insurance, which I will say is important for big things. We do encourage everybody to have at least a kind of high deductible plan for those things you can't foresee or big procedures.
Sure.
But for the day-to-day care of a kid, a well check, sore throat, ear pain, they puke today, depression, anxiety, all that stuff is very hard to make insurance worth it for a family. And you're usually chasing these deductibles that end up being quite costly without a lot of benefit. And so direct care just kind of steps out of that space and is, for many times, and for my clinic included, much cheaper than what visit costs are in big institutions and facilities. And we have so much more time and more access, which a lot of families really find that they would like.
Yeah, for sure,
Yeah.
for sure. So, how did you go about setting this up? Because I think for a lot of people, it's like, wow, where do you start,
Yeah.
right? It's one thing to create an LLC, start a company, but when you're talking about medicine
Right.
and,
Yeah.
liability insurance and all of these things, now having your husband, of course, helped because he was in private
Yes.
practice, but, what was the determining factor? Like, I'm ready to do this and here's what I need to do.
So when I left the big organization, I did some what we call locums, which is a small part of why healthcare costs are so high,
Hmm.
that many places can't find physicians, so they'll have like substitute doctors. And I did a very short couple of times doing that, and it was hard to be away from family, and it wasn't just something that I wanted to do longer term. And
Hmm.
I thought, you know what, I just need to start something. And there are multiple groups in private places, like on Facebook, for physicians who are interested in direct care. It's a growing, really powerful movement. And so I really sort of leaned on a lot of those. There's a lot of great conversation happening in those spaces that I was able to get into and really learn from these other docs that they're like, there's a better way to do it. It's
Yeah.
safer for the doctors. It saves your sanity, preserves your longevity of your career, and also better serves your community. So I figured
Hmm.
um, I'm just going to do it. And
Yeah.
so it was really right after the 4th of July. I was like, you know what, we're just gonna do this. And
Yeah.
I just sort of started with the big pieces first. I talked with a lawyer and my accountant about the type of organization. I set up an S corp, and I have a medical license and I'm board certified. So that piece is kind of like done, and I'll never lose that as long as I continue that piece. But then malpractice was something that was a little bit of a hurdle, and that was always given to me through the practice I was previously with. And so it was daunting to find a cost-effective, comprehensive one for that. And
Hmm.
again, it was talking through several forums, got connected with a group that works mainly with direct care doctors in the state of Wisconsin, and really amazing business insurance as well as liability that gives me
Yeah.
everything I need, but was a super affordable way to do it. And
Yeah.
so, once those kind of big pieces were in place, I really wanted to make it something different and special. And so I got some contracts where I can order medicines. So in the state of Wisconsin, physicians can dispense medications
Hmm.
just like a pharmacy. I have to document in the same way that I would have anyway. You just kind of keep a record of what I've sent in, which is not hard.
Yeah.
So I have been able to order the common antibiotics, liquid, different creams and stuff that kiddos tend to need. And I found people love it. Like, if, look, you
Yeah.
have strep throat, like, we can fix it. Would you like to just leave with your antibiotic? Or I can give your kid the first dose and kind of show you some tricks about,
Yeah.
doing
That's
that.
amazing.
And most moms are like, oh my God, for $6 I can avoid CVS,
Yeah.
or pick a pharmacy. And especially with sick kiddos in tow, as a mom, I just thought that piece would be helpful. And that's been really great. Another
Yeah.
piece is how to do lab tests. And so I was able to contract with Quest, which is a large lab organization, so I can mail
Mhm.
specimens and do anything I would have otherwise done. And then I can do like in-house testing through what's called a CLIA waiver, which wasn't hard. It was just some paperwork. And,
Yeah.
none of these pieces were hard, but it's daunting altogether.
Yeah.
All that to say, just kind of getting those, I feel like it was just one day I was like, okay, now we're going to figure out labs. Now I'm going to figure out
Yep.
how I would do imaging, and just kind of, it's been a day-to-day kind of learning curve. But
Yeah. How has the response been?
it's been really great. I have about 180 children registered to my practice, which is crazy. I
Yeah.
never thought that it would be like that. My direct care practice, at least how it stands now, due to the restraints of my current non-compete, is a little different. Most direct care practices have a membership, and so you
Mhm.
pay a certain amount monthly and get all the care you need and messaging and all of that. Because of constraints I currently just have it where patients can just pay to come see me for whatever visit type. So today I did 3 checkups, and that's all that family will pay for until the next time they need care. And so all that to say, it's a little bit different that way. And I likely will look into a membership option once I'm freed up a little bit, just
Yeah.
from a business perspective, having more consistent and reliable income that way.
Mhm.
But this has been a great way to kind of grease the wheels and troubleshoot as things
Yeah.
come up. So response has been excellent. I feel like, especially with the anticipated healthcare insurance changes
Mhm.
coming in 26, there's a lot of families that have reached out and are interested in kind of what this looks like and what's include, just people who are starting to contemplate and hear about it. And anyway, so I think the response has been great. And this whole, first year, I'm just kind of hoping for figuring things out and then some gentle traction. So, yeah.
What has been the most rewarding thing so far?
I think the freedom for me to practice how I want to. I've been able to offer care to, a few low-income families that I've been able to say, like, we'll just do it for whatever, I'm just going to give you good care and I'm going to spend a lot of time with you and make sure your concerns are addressed because you're worth that. Of course you are. And, when they previously had not gotten that message, and being able to spend so much time in my previous life, I would see 30 kids a day. And I compared myself to like a Walmart checkout. You just are like kind of this revolving door. And, patients don't like that. I don't like that. And I feel like, now families can come to me and we can talk for as long as they need to and kind of really troubleshoot. And I feel like that saves a lot on the back end from a physician standpoint. Many times doctors in many spaces will grumble about, patient messages and calls. And if you can address it when you're with them and make them feel heard and make a plan, many times that, kind of handles anxiety and sets them up with a plan going forward. And I think that's something that I feel like many patients feel is missing, is just kind of a clear direction and what to do if and those sorts of things. So I feel like I have a lot of time to button those pieces up when I previously might not have had that time. Yeah.
That's amazing. So how are you handling capacity as you think about, going forward? Because I have a feeling that your practice is going to explode once people first learn about it.
Right.
Then to understand how to access it and what that's going to mean. And we were talking earlier, even myself tried to make an appointment and it's months out, right? To get any type of an appointment. And so how does that differ with your practice?
Yeah. So right now, just as I'm growing, I sort of have for right now, for an example, Monday, Wednesday, Friday. And but the cool thing is I can do whatever I want. So I have, for example, this Saturday clinic, I have several patients scheduled. I've made an effort for at least once per month doing like a late Thursday. That day just works well with my family, kind of with kids running less places. But all that to say, I plan to, and I pledge to grow as we need to. So I'm one person, and the limit of this model is that you can only do a good job with a certain number of people. So, but all that to say, as I need to, I have a lot of capacity to grow. And if needed, there's a lot of doctors and people interested in this type of care. So I feel like if I can build something that's sustainable, could I in the future get some other really high quality providers that practice how at the caliber that I like to, I think there's so much opportunity for growth and expansion. And I get asked every day, like, do you take care of adults? I'm like, no, I don't. But, someday finding somebody, if that's going to be what the community needs, I'll just morph it as we need to. So.
Yeah, for sure.
Yeah.
So one of the reasons I wanted to do this in December is, of course, you're relatively new to the community, and so we wanted to make that introduction, but also because, as we know, it's vaccination time, it's flu shots, it's kids are getting the sniffles, it's vacation travel, people coming and going for the holidays, lots of germs being spread. And so, I'd love you to talk a little bit about that piece and how, going into the holidays now, what parents should be thinking about. If they want to access care through your clinic, what does that look like? How does that work?
So I guess so I have 3 kids myself. I'm a pediatrician. So every winter is, I got a kid coughing at home. I'm like, oh, great. Here we go. Here's another one. And that'll circulate through all 5 of us, I'm sure. But so I think the number one thing for parents to know is it's normal for children to get 7 to 12 illnesses per year. And most of them are compressed in the winter. And why is that? Lots of reasons, but we're all together a lot. Schools are, doing a lot of things, and we're, gathering a lot. So I think just knowing that piece is normal. Things that aren't normal are like persistent fevers more than 3 to 5 days, kiddos not drinking, breathing problems, recurrent breathing problems. So all of those are things I can help with if they become an issue. But just knowing it's like no fun, but there's really no magic wand. Good things are hand washing, hand sanitizing as much as you can. We know that that's obviously so important, especially for kiddos before they're eating, or when my kids get in the car, I like pass around the hand sanitizer. It's not perfect, but at least gets us a start for some kind of clean evening. And then trying your best with good dietary choices, fruits, vegetables, getting those nutrients in, which is hard for American kiddos, but especially running around like busy families. But all those pieces plus good sleep can help keep kids feeling better. But if kiddos get sick this winter, if I'm in clinic, I can see kids. And so, definitely families can find my website, which is revisionwellness.health, and has kind of information on there. Patients can register themselves. There's no cost to do that. There's no membership fee. It'll say that there's a membership you're selecting, but there's no cost to that. And then you're kind of in the system, and then you can, like, on your phone, just select a time, just come in, we'll get everything figured out. And as I said, we can do all the testing needed, strep, flu, whatever, and then leave with medicines if needed, or I can send them into any pharmacy. So kind of a one-stop shop there. It's all through the website, which directs you to my medical record system. It's pretty easy, but my phone number is also on there too, and I'm happy to walk through that with families and field questions that way.
And what about integrating into the larger health system? If you see someone, you feel like they need something more than what you could provide in office, what do you make a recommendation, make a referral? What happens at that point?
Yeah, I can absolutely, and I have done referrals through my medical record system, which is very easy. I have good relationships with a lot of the docs at Marshfield and other places at UW-Madison when we need to. So I would say, with my expertise, I'm able to handle 85+% of what goes on. But absolutely, if we reach a place where we definitely need to get more help or specialized help, that's still super easy to do. And I can help walk you through that, make calls, make sure things are getting in and getting taken care of. If kiddos look too sick to be cared for in my clinic, I have enough meds to kind of get us safe. But just like in my old life where I would have to call EMS or send a family to the ER for further care, it would be a similar situation. But I've taken care of plenty of sick kids, so I would know, like, what's too sick, what needs to go, what I can care for. So so definitely a good place to start unless there's emergent concerns.
Nice. Yeah. So you're starting in Marshfield.
Yes.
And you have future expansion plans, right? Can we talk about those or not quite yet?
Sure.
Okay,
We sure
wonderful.
Can. So I'm so grateful to be here, and I picked Marshfield when I had a lot of patients who came to me from Marshfield. And so I felt, kind of being in a place where it was close enough to where I was previously practicing, but outside my non-compete. And I also had some families already kind of traveling that distance. But also I just felt there was a great opportunity in Marshfield. I mean, obviously there's a great health system, but also has access issues. And I just felt there might be some opportunity for high quality peds care. And so I, have no plans to abandon Marshfield, but I am from Wisconsin Rapids, and my husband and I own a building where his practice is. And so at least part-time in both places when I'm able with my non-compete, which will be not till 27. So lots of time here. And I've just been grateful to the community for letting me kind of figure things out and help them.
And I think it's been pretty welcoming, yes?
Oh my gosh, yes. Oh, it's been amazing. It's been really great. And I'm inside of Inovia's clinic, which is another direct care. They work mainly with employers, but also do, some kind of individual plan stuff. And anyway, they've been, they're a really great resource, and kind of, we've been able to kind of co-troubleshoot a lot of direct care things together. And so they're another great resource. They take care of grownups, and they're all over the state. So that's kind of a neat model that I've been able to watch as well as I've gone through. So.
Well, I know I've talked to a lot of people who have been really excited to meet you.
Oh, yeah.
So I think that's been really fun. And, I see that you've been getting out and about, and you've done even like some webinars and different things. The Hispanic community. I know you talked a little bit about that. You dusted off your
I sure did.
Your college Spanish.
I sure did. Yes. That was amazing. And to be able to be connected and through the Coven and your kind of connections has been really great. But I did a podcast. I have a Spanish major and I'm conversational. I sort of joke that through medical school, my brain sort of melted and, I lost a lot of previous skills. But all that to say, I definitely still consider myself conversational. And and I think there's an opportunity in that population, especially who might not feel comfortable or able to seek care in traditional settings and still deserve great pediatric care. And so any of that, I'm so passionate about helping whoever needs the most help. So.
Yep. And so how do you handle then the entrepreneurial side of this? Because I mean, at the end of the day, you're trying to be a full-time practitioner and trying to handle all of these other things that are going on, which right, is not easy.
Right.
Even though you're not having to deal with claims necessarily, there's
Right.
still a lot there to track that. And so
There
how has
is.
that piece been?
Yeah, it's been a transition. I feel like, and I read somewhere that as doctors, we've gone through enough learning that we really can learn anything. And so I
Mhm.
just sort of took that as a motto, like I can figure literally anything out and given
Mhm.
enough time and a couple of resources. And that's been the great thing is, in a direct care clinic, it's not 30 patients a day. So I do have some time built in for some of those businessy things.
Mhm.
And I think too, my husband's been a great resource and a
Yeah.
couple other business people in our lives that I've been able to bounce things off of and kind of learn that financial side and, kind of going from there. So it's not, the finance piece isn't much different than like running a home,
Mhm.
kind of ecosystem, which I do. And so just sort of extrapolating some of that. And,
Yeah.
it's just been a bit of a transition. And I
Yeah.
think, but it's been fun too. I feel like I've, really kind of honed my medical skills. Obviously, this is a lifelong learning thing, but
Mhm.
I wouldn't have wanted to do this path right out of residency, right
Yeah.
out of training, because I feel like there's so much doctoring things you need to learn even after you're out of training. And now I
Mhm.
feel like I'm comfortable in a place where I can learn these business pieces and trust my clinical skills. So I
Yeah.
think the timing is perfect that way for
Good.
me. So yeah.
Well, and one of the things that we talked about a little bit um, before we started rolling was the fact that there are so many changes in healthcare, though.
Yeah.
And so that's, a whole nother piece, which is with
Right.
any industry, right?
Yep.
I mean, you're going
Yep.
to have
Yeah.
legislative changes and those kinds of things, but healthcare is an industry where things are just, it seems like constantly changing.
Right.
And we're constantly having to evolve
Right.
in how we're practicing. And, we talked a
Yeah.
little bit about just the most recent black box warning that came off of estrogen.
Right.
And, even though I deal with that more in an adult capacity,
Right.
that's something that you have to deal with in children.
Yeah.
And, so all of these changes are constantly having to be implemented into your practice.
Right.
So that's a whole nother piece,
It is a
right?
huge piece. I think that there's twofold to that. So like one is like the change to structural healthcare and like how it's so complex and why it is and how that's only getting worse and more expensive. There's
Yeah.
10 administrative people, so non-medical people for every one provider who administers care in the United States, which is wild. Like, can you name another business where like the people who are like the service providers who are bringing in the income, the only people able to like generate that type of revenue, if there's 10 people who are managing them, there's no other field like that. And
Yeah.
so there's many reasons for that, the complexity of insurance, kind of all the bureaucracy things. But so there's those inefficiencies that are costing the American public. But then also, as you mentioned, the medical knowledge is doubling like very rapidly every 7 months, they say. So like from the 50s to the 2000s, it doubled every like 50 years or so. And now we're like on the span of months. So it's
Yeah.
very hard for physicians to keep up with the advent of AI. Makes it a little bit easier, obviously some challenges with that. And so it's been a ride, trying to keep up with those pieces and stay relevant and safe, obviously, and families are expecting that. So yeah, there's
Yeah.
two kind of odd pieces that are kind of in tandem,
Yeah.
making things complex. But
Oh, that's amazing. So you have 3 kids at home.
yes,
And so how has that balance been?
it's been good. I feel like this is a great time. I'm actually home more for them and with them than I was in my previous life, even with the travel that I'm doing now. But they're great. They're 12, 9 today, and 6 years old. And so I feel like my second full-time job, aside from being an entrepreneur physician, is being an Uber at night.
Yeah.
But they've been really great and supportive. And I think I hope they see what their dad and I do and
Mhm.
what we've built in our building
Yeah.
and are just know that they can do something really cool. Hopefully not in medicine. Like I don't know, I don't know if I wish that on them,
Yeah.
but in whatever field they choose, I think there are times where I feel like, oh my gosh, what are we doing to that? We're
Yeah.
taking a lot of time away from them, but I do think there's a lot of cool lessons
Yeah.
that they're exposed to. So
Yeah. Well, and the other thing we were talking a little bit about is that as an entrepreneur, there are days where literally you're like,
yeah, what am I doing?
what am
Yeah,
I doing?
yep,
What was I thinking? Why did I think that this,
yep,
and then, you go to bed, you wake up the next morning and you think, okay, today's the day that I'm going to tackle this
yep,
and then this. And, it's
yep,
kind of a never ending. I think
right,
that's the thing that I've learned most working for myself versus working for other people is that the grind never stops.
Right.
Like if
Right.
you want to stay ahead of things, you just have to keep grinding and grinding. And so,
Yeah.
but I'm so grateful for the fact that we have people like you and other people that are making these changes in our community, both for healthcare and for our community
Right.
as a whole. Because,
Right.
I say this a lot, that a lot of the things that we see and experience here, being in the Midwest, we are oftentimes late adopters.
Right.
And I think healthcare is no exception to that rule. We've
Yeah.
been very, very fortunate to have such an amazing health system and health systems
Yep.
within our
Yeah.
area. But the fact that we have so many people now like you that are willing to branch out and say there are other ways to practice medicine,
Yeah.
and we can do that here,
Right.
and we can figure out ways to do that. And we're seeing that
Right.
more and more, understanding that there's adult healthcare providers. We're
Yeah.
seeing more nurse practitioners
Yeah.
leave large health systems and start to open their own practices. We see that a lot in the hormonal health side.
Right.
I think pediatrics is one of those that's probably next in line, so to
Yeah.
speak, in
Right.
that, we've been addressing a lot of things in different areas of healthcare. And now
Right.
we're seeing a lot of that change on the pediatric side, which is just really exciting.
It is. I believe I'm only one of 2 direct care pediatric practices in the state of Wisconsin. The other is in a
Oh,
Milwaukee
wow.
suburb.
Okay.
And she's great. We've talked a lot and, just kind of
Yeah.
like, but there's a lot of interest for this model, both from physicians and I think from families. And so I think, I really ask patients to just really sort of think about, what's working with how they get healthcare now. Look at bills. A lot of times people think, oh, checkups are covered. I'm sure you've heard too, but like many times if you bring up anything at a well visit, that's not a well, like, yes, I'm totally healthy, thank you. If you say, oh, her ear hurt today, pulling at her ear, can you talk about her tummy pain? All of that is billed as separate visits, and then you get some $400 charge 3 months down the road, and
Yeah.
people just sort of roll and pay it, and just really sort of looking and being thoughtful about like what exactly is our money going to,
Yeah.
and just that the alternative options exist, and many times for families might make more sense, especially for the kind of common or routine
Yeah.
childhood stuff that comes up. And I just believe that kids deserve high quality pediatric care
Yeah.
and specialty care, which is why I do what I do. And
Yeah.
and places like ours are becoming deserts with this type of care,
Yeah.
similar to the OB deserts that are forming all over
Yep.
our country. This is just going to kind of keep rocking healthcare. And so
Yeah.
I'm hopeful that by stepping away when I did and building something different,
Yeah.
it'll do nothing but sort of help Central Wisconsin kind of be a solid place, at least for our kiddos.
I
So,
love it.
yeah.
Okay, couple of speed round questions. What is the most interesting thing that one of your children asked for Christmas?
My son is really big into aviation and loves flying and
Nice.
stuff.
Okay.
And so he wants to like go on more trips so he can just like stare at the pilots. And we're like,
love
okay,
that.
well, that's actually a good one. But
That's a great one.
but yeah, I think the other ones were just very traditional, like Roblox gift cards
Yep.
and new dolls.
Yep.
And, so nothing
Yeah,
kind of out of the
for
box.
sure.
But my oldest always throws something
sure.
crazy at us. So,
For sure.
yeah.
So, second speed round question. What has been, if you need 5 minutes of like decompress in the middle of a day, what's your favorite thing to do?
I'm big into meditation, so like that generally is about enough time for
Yep.
me, though I do like more walking my dogs is great because it gets me outside and that always is a good reset.
Yeah.
And then when I have more than 5 minutes, I do my best to exercise most days of the week, just
Yep.
more for my mental health than for any other reason. So
Yeah, amazing.
Yeah.
Fantastic. Well, it was so great to have you,
Well,
Amy, and
thank
it's so
you
good
so
to
much.
see you
It was great
always.
to
Of
meet you.
course.
Thank
I feel like we can hug
Yeah.
versus, but we did that at the
Thank you.
beginning. It is so good to see you.
Thank you
And
for having me.
thank you so much to everyone for tuning into this episode of Innovate Marshfield, the Coven Connection.
Innovative Marshfield, the Coven Connection and Marshfield broadcasting is sponsored by the Vault Marshfield. This downtown hub brings entrepreneurs, creatives, and small businesses together under one roof. Enjoy co-working with the Coven, Uptown Coffee, and boutique shops at the 715. The Vault is where ideas grow and community thrives. Learn more at vault-219.com and thecoven.com/Marshfield. Thank you for supporting local community TV.